Welcome back, everybody, to Peptides and Age Management with Dr. Kris. Dr. Kris, how are you?
I'm really good today. How are you, Steve?
I'm doing well. I missed you, and I'm looking forward to this. These are always fun conversations, especially when we actually get them to go live. So thanks for hanging in there with me. So, Dr. Kris is Dr. Kris Wusterhausen of the Resurge Clinic. He's becoming the voice of those that want to take more control of their health and to age better, to feel better, to be around and be present for the folks we love. And these conversations are intended as educational, and always consult your physician before changing your medical program. And today, our topic is the microbiome. What is it and why do we care? So, speaking of microbiome, Dr. Kris, what did you learn in the past couple of weeks besides that?
Well, so the microbiome is always a topic that still, well, not still, but used to make my eyes kind of glaze over. And it's one of those topics that when you mention it to providers, it seems quite overwhelming. Not quite sure where to start with patients. It's such a broad topic. It affects so many things. So, as you know, I just came back from our latest fellow meeting at the SSRP, I guess now a couple weeks ago. And we spent 2 full days learning about the microbiome. We also spent a full day working on cadavers, learning how to do stem cell transplants. That was, I guess, something else I learned about other than the microbiome, which was kind of cool.
So when we talk about microbiome, there's a word microbiota, microbiome,
Mm-hmm.
in antibiotics, probiotics, prebiotics.
Prebiotics. Uh-huh.
Yeah, and so all these biotics and it's going on in our gut. Let's get those straight first.
So I like to just start with what is the microbiome,
Mhm.
and we don't realize it, but most of us have over 1,000 different bacterial strains living in our gut. It is a symbiotic relationship. They need us, we need them. They help digest our food, break down our nutrition, so that we can source it and use it for energy. And so, simply, the microbiome is that the microorganisms in your gut system. I think the prebiotic, prebiotic and probiotics is actually something that I kind of want to get into because, that's something that I'm just now starting to really understand when to use one versus the other. And they're two totally different things, pre and probiotics. And there's all different kinds of probiotics, but anyway, I think that let's dive into that maybe kind of more of how to treat the microbiome a little bit later is what I would say there. And of course, antibiotics are, medications that treat bacterial infections. But unfortunately, most of the time when we take an antibiotic, we're actually disrupting that microbiome, causing dysbiosis, which simply means, dysbiosis simply means you're interrupting the normal microbiome in the gut. And not only do antibiotics do that, but stress can do it. Of course, diet can do it. Disease can do it. Of course, it's kind of like chicken or the egg. We're learning now with the microbiome that the microbiome affects everything. I mean, I think just a little bit ago, you sent me an article that was about Parkinson's and the microbiome, and they're actually learning that autism has a lot to do with the microbiome, heart disease, lung diseases. Really, Dr. Seeds makes the point that you can trace all diseases in some form or fashion back to the microbiome. And if you simply correct that microbiome, you have no choice but to at least somewhat improve whatever disease you're trying to treat.
So dysbiosis is when we disturb it. I was reading where we always say stress, avoid stress and whatever, but it can actually, you get that feeling in your gut when you're stressed or when you have anxiety that really connects with your brain.
Mm-hmm.
And so when we take antibiotics, when we eat a highly processed diet, when we're under stress, when we're not drinking much water, this is really damaging or putting our microbiome at a disadvantage.
True. And I think one of the things to kind of to make it more simplistic, and this is actually something that I learned a couple of weeks ago that helped me get a better grasp of the microbiome. We've already said there's over 1,000 different types of bacteria species living in our gut. There's all these different kinds of organisms which really we don't need to know. What we really need to know is that there's two types. There's the good and the bad, and the good is called obligative anaerobes, and then the bad is called facultative anaerobes. And so if we just kind of break it down to good and bad, and this I think somewhat ties into our previous topics because we're always talking about cellular homeostasis.
Hmm.
And really and truly, that's what we're looking for with the obligate versus the facultative anaerobes. They're both going to be there, but we want them to be in a somewhat of a symbiotic, a homeostatic relationship. And we want to put those obligate anaerobes in a state where they're able to thrive and that the facultative anaerobes are not able to take over. And ultimately, when people have dysbiosis, again, a dysfunction of their microbiome, it's because the facultative anaerobes have somehow gained the upper hand when it comes to the microbiome.
So dysbiosis, how do you know? How do you know when you don't have a healthy microbiome?
So that's a great question. And you can actually do really exotic, not exotic, that may not be the right word, advanced GI testing with stool studies and this sort of thing. But really and truly, I think for the most part, it comes back to just history and physical, and mainly history. And anybody that shows signs of inflammation, weight gain, insulin resistance, blood pressure being out of control, any of these things, we know that when you have these things that you're going to come back and you're going to have dysbiosis. It simply is the first step to causing these different problems. So if you have already the full-blown problem, you know that you have dysbiosis. But also just asking a person their gut history. It's something that as a physician, I don't believe I've done a good enough job talking to my patients. It's kind of that pardon the pun, the dirty little thing that no one likes to talk about. Like, how often do you go to the bathroom, Steve?
Right.
You know, what is the consistency of it? What does it look like? And you'll find a lot of people, even especially women, don't have bowel movements every day. They may go days without. I guarantee if you're going days without it, you have dysbiosis. You really should have 1 to 2 bowel movements a day. What's the consistency? Is it fairly soft? Is it, so if you do some of these things as providers, you will find that actually way more people have dysbiosis than don't. And then, you can go with reflux, just stomach indigestion, stomach upset. Those are also signs of dysbiosis. Again, because of the American diet and the high stress environment that we live in, I know I have dysbiosis. It's something I'm going to start really working on for myself. And I feel like most of my patients also have it as well.
So when we think about what can we do to, how does the microbiome affect our immunity and contribute to disease? When you talk about that, when you tell us a little more about that, in the back of my mind, I'm going, what do I do? Is it like an easy fix, or does it take a long time?
Well, I think there's small things that we can do that make big changes with their microbiome. And that's what the really cool part of my takeaway from the fellowship meeting is that we really kind of made this more complex than maybe it needs to be. This is one of those scenarios where doing some simple things, I think, can make large changes with it. Now, not everybody's exactly the same, and this is definitely where we want to recommend people talk to their physician. First of all, let's kind of get in the pre-probiotic thing. I think this is a good time to introduce that topic. And so what is a prebiotic? What is a probiotic? Well, a probiotic is just living strains of the actual obligate anaerobes that live in our gut. So it's the good bacteria that live in our gut. We're taking it in an oral form. So we're just trying to put more of that organism into our gut, basically trying to replenish what's already there, maybe lacking. A prebiotic is actually specialized plant fiber that is basically the food or the fertilizer for the obligate anaerobes. So you might want to think as a prebiotic as I like that term as the fertilizer for the good bacteria in the gut, which we've discussed is called the obligate anaerobes. And so that's kind of the differences. And, we really push probiotics, and I'm not anti-probiotic, but it kind of goes back to our discussions of the cellular function. If we give the body what it needs to produce what it needs to produce, it has a high likelihood of doing very well. And I think that's why you're seeing a transition in the medical field from probiotics to prebiotics. Some companies make the pre-pro together, but I think that you could start a person on a prebiotic, really, kind of fertilize that ground for it, and maybe change them to a probiotic, and maybe even cycle those things. But again, that's discussions that your provider can really talk with you about. But I think the prebiotic really has a lot of potential to help people with their dysbiosis.
So what foods are good for your gut microbiome if you're thinking, okay, I want to be more proactive, like the folks that listen to this, they want to take more control of their health. What are some of the foods that you would recommend that would support this new initiative, if you will?
So I think that brings us into the next topic, which is actually butyric acid, better known as butyrate. And butyrate is a small chain fatty acid that we find in fruits, vegetables, legumes, and some of our whole grain foods. So I guess my quick answer to that would be fruits, vegetables, and legumes. But most of us don't have enough butyrate in our diet, especially with, and I actually recommend this dietary plan for a lot of my patients, especially with more of the phase of the high protein, high fat, low carbohydrate diet. We're getting less fruits and vegetables at times in our diet, causing us to have a deficiency in butyrate. And butyrate is actually also produced by the obligate anaerobes. So when you look at the colonocytes, which is the cells of the colon, they're wanting a really, they call it a tight junction. Basically, obligate anaerobes, the good bacteria in our gut, does not like oxygen. Oxygen basically allows the facultative anaerobes to take over and gain the upper hand. So we know that as we get higher butyrate levels in the gut, we actually tighten those gaps. We keep the oxygen levels low. We're able to have the obligate anaerobes succeed and do better, and gain the upper hand on the facultative anaerobes, giving us a more healthy biome. And so that was the one big takeaway I had is that butyrate, which is a nutritional supplement, yes, we find it in fruits and vegetables and legumes and whole grains, but butyrate's a very inexpensive supplement. It's not a prescription. You can get it online. It's not expensive at all. Going to cost a person $20-30 a month for their butyrate. And you're giving the body what it needs to have the microbiome in a nice homeostatic state. And then when you combined it possibly with a prebiotic, at least temporarily, you're really setting the gut up to do well and succeed. There's other things, of course, we'll get into that we can do, but that's a really good start for a lot of patients. Easy to do. Typically a lot of the patients will start with 1 to 2 capsules before a meal, and maybe try to work up to 2 capsules twice a day. It's usually fairly well tolerated, but you can get some GI distress from it. That's why you want to just start with 1 or 2, see how you tolerate it, and kind of titrate up from there.
So, these supplements that you can take that are fiber supplements, like I'm at a loss with the brand. Yeah, are those considered a prebiotic?
No, because they're not the specific fiber that you need. They're just straight fiber. So you're going to use a Metamucil or something of that nature for simply bulking of the stools. It's proven that as we age, if you bulk the stools, you get less chance of diverticular disease. So you get less colonic issues from diverticular, little pocketing of the colon. And so that's why they recommend the Metamucils. And it's also just makes your gut gut more regular. So not a bad thing to use, of course, but wouldn't be considered a prebiotic, excuse me.
Well, I was really excited about the BPC 157 because, I have some issues.
Hmm.
I was really excited about that. But what really struck me, I was listening to someone talk about intermittent fasting, and one of the ways that you heal your microbiome, the mucus, you give your gut time to reestablish the mucus that it needs, is fasting.
Hmm. And so fasting also, so other things you can do for the gut, exercise. Exercise increases the obligate anaerobes in our gut, which when you have more obligate anaerobes and you have more butyrate, when you have more butyrate, your body's able to make the amino acid tryptophan in a higher quantity, which tryptophan is absolutely necessary for serotonin. We use serotonin in the brain and the gut. It's very, very important for our overall health and mood. That also leads to a process of increased B cells, which leads to the increased T cells. We always talk about how your gut and your immune system are tied, and that's the tie-in. So that's really, really important. But when you start getting into the fasting aspect of things, fasting, in addition to all the things that you and I have talked about over the last few months, fasting increases the enzyme called AMPK. And AMPK is always in kind of a tug of war with the enzyme mTOR. And AMPK is a catabolic process. It's actually where autophagy basically is able to take over and clean up the cells. So we call when AMPK is in control or dominant that you're in the housekeeping phase. You're cleaning out the house. You're doing all that good stuff with autophagy. You're repairing the cells. You're repairing the cells. The mitochondria are able to function at a higher, better level. And so fasting increases AMPK, which when that catabolic autophagy phase, it helps those colonocytes, which are in the colon, clean up everything and function better. So that's how the intermittent fasting ties in. And it helps battle that mTOR so that mTOR doesn't take over. We do want mTOR, just like everything. We want good and bad. We just don't want more bad than good. mTOR is actually how we get muscle growth. So when we do resistance training, we increase our mTOR levels in the body. And so we want that, but also insulin resistance, cancers and tumors, stress can increase mTOR. And so, again, it's always about finding this homeostatic balance within our body between these different entities.
So much goes on with you take some of these supplements like the ketone esters, and whatever convinced you to take it, you think you're solely impacting those, but you don't realize all the other things that you're helping support in your healing process.
Yeah, I think the best way I can explain it is you're helping your cells, but you're helping the cells all over the body. You're not just helping the cells in your brain or the cells in your lung or the cells in your heart. You're helping every organ system you have. And, you have to really start thinking about how everything works together. But again, one of my big takeaways from this is that really it all comes back to the gut, and how it's a definite how the gut is the most important part of all the different systems to make sure that it's healthy. If the gut is healthy and doing well, you have a strong possibility of doing well with the other organ systems, at least doing better. You're going to lose weight. You're going to feel better. The energy levels are going to be there. You're going to sleep better. You're just going to feel better. I mean, anybody out there that's listening, when you have dysbiosis, when you have a poor gut function, it can be debilitating. I went through some issues with my gut recently, and it really made me look at my diet and stress levels and change some things. And it was amazing how you just make a few little changes and all of a sudden everything starts to do better again.
It can surely demand your full attention and ruin your
No
day
doubt.
when the gut is rebelling against you. So, talk to us about, everybody says diet, 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 but specifically, give us some direction on maybe like top 3 things we can do that would make a big change.
So I think one of the big things that I would put in the top three is of trying to avoid inflammatory foods. All of us have some form of inflammatory. First of all, I recommend a good food sensitivity testing for all the patients. I think it's really important that you test yourself against the most common foods that we eat and see what you may have sensitivity slash allergies to without knowing it. I think we've discussed it before, but so many patients think they only have an allergy if they break out in hives or quit breathing. And obviously, there's a lot of other less inflammatory reactions than the most severe that you can have. So I think it's really important that patients get these good food sensitivity testings. I think there's some out there that are really inexpensive that I'm not so sure are very good. But starting with that, just learning what you like. I'll use an example of one of my patients the other day. He really good shape, but he really kind of hit a plateau. He works out a lot, and he's like, man, I just can't seem to push through it. We did a food sensitivity testing on him, and he was highly allergic to eggs. Guess what he had every morning, 7 days a week for breakfast? Eggs. He's cut those out, and he's like, man, my gut feels better. I'm having less bloating. He's starting to see gains in the gym by no changes whatsoever other than cutting eggs out of his diet. My wife the other day found out she was allergic to coffee, things that she does every day, but not how she's very disappointed in that one, by the way. So she'll probably chime in a second. But anyway, so I think that's one thing that's really important, figuring out what you have sensitivities to. And then just avoiding those inflammatory foods that we don't have allergies to, but we know that they're inflammatory, such as high sugar products, sodas, fried fatty foods, the good old chicken fried steak, staying away from those, staying away from the refined carbs, your pizzas and your breads, your white foods, basically your white flour products, staying away from those. Alcohol, that's another one that's highly inflammatory. Processed meats. If someone came to me and said, okay, doc, I want 3 or 4 quick tips to really get my gut under control, it's going to be get your food allergy testing done, see what you're sensitive to, cut out the inflammatory foods. Let's get rid of the sodas and the fried foods, and let's get rid of the white flour products. Let's try to drink a little bit less if we drink a little too much. Let's mix in some butyrate. It's cheap. It's easy to do. Let's start with a couple before a meal. See if we can't get it up to two twice a day before a meal. Let's mix in intermittent fasting. Let's get that AMPK levels up so that we can get the gut health doing the best it can. Let's get all the other positive functions of intermittent fasting. Once they master that, like we've talked about, let's mix in some longer fast as we can, and let's get to exercising. Let's give the gut what it wants, and let's put those obligate anaerobes in the most positive shape it can to do well. And I think if a person would literally take those 4 or 5, however many tips it was, I think they have a really, really good chance of doing very well. We didn't spend any money on expensive stool testing. There's nothing that I just recommend, in my opinion, that's going to hurt anyone. We have the testing of the food sensitivity, but that's not crazy expensive. And other than that, we can get started, and we can start there and just start seeing how a patient does with those simple changes.
So when we think about, we took a round of antibiotics. All of us, I'm sure, listening, have taken at least one, if not more. That pretty much goes and knocks out all of your biome for a while, right?
Yeah, your obligate, your good ones, yes.
So how do you reestablish that? Maybe you take a bunch of probiotics, drink some kefir. What's the good plan?
I think that would be a place, maybe even where you look at the probiotic combinations. Now they are making those, or simply just a probiotic, mixing that in, of course, with a good diet at the same time, maybe mixing in some of your yogurts and things of that nature, giving the gut flora what it needs to do well. I really believe that, well, first of all, let's go back to what I should have said first of all, making sure we really need the antibiotic. Asking the providers out there listening, does the patient really need the antibiotic? I believe a lot of the time the reason the antibiotic is given is because the patient is forceful in pushing the provider towards, I want an antibiotic. And I think that Lord knows I've been guilty of this in my career. It's just kind of like, oh my God, the only way I'm going to make this person happy is to give them antibiotic to get them out of my office. I don't think they need it, but I'm just going to do it because it's just the path of least resistance. And as providers, we shouldn't do that. But I think everyone that's a provider's done it at some point in their life. Educating your patients on why maybe you don't need an antibiotic, making sure they understand what really constitutes a bacterial infection. That would probably be my first thing. Two, using the antibiotics for the appropriate length of time. Sometimes a lot of times we overdo it with the length of antibiotics, and we overdo it with the strength of the antibiotics. We go with the big guns first, hell, this kills everything. So let's just do that. And we're good because we don't think about the microbiome. So then when we get to the microbiome, back to the butyrate, back to the probiotics. And I think if you would do those simple things, I don't think you'd have to change diet a whole lot actually to do quite well in those scenarios if you follow those different guidelines. But Lord knows there's going to be situations where someone does need a potent long-term antibiotic. And I think those are the ones that I would actually really push towards the probiotics. So it's really just kind of really looking at everything individually and working with the provider. And it also takes the providers talking to the patient saying, okay, I'm going to give you this antibiotic and I need you to do these other things at the same time to preserve the microbiome. Again, microbiome is a topic that most providers don't like to discuss. It's kind of like hormones. It's just like, oh God, I don't really understand it myself. I don't want to go there with the patient. And I have to admit, that's where I've been at some points in my career as well.
So are there supplements that would be called a prebiotic? Is that a butyrate?
So butyrate's not a prebiotic. Butyrate is a small chain fatty acid that is produced by the obligate anaerobes that we find in fruits and vegetables and legumes. So it is a supplement, but it is not a prebiotic. So we would actually want someone to try a prebiotic along with butyrate. So two different supplements, both supplements. As far as and the butyrate that we like is the Body Bio is the website. We have no affiliation with Body Bio. They just make a quality butyrate product for a reasonable price. You can actually get it on Amazon, or you can go to Body Bio and get it. They have a couple different versions. They have one that's salt-based and one that's magnesium-based. It really doesn't matter. They say the salt-based, the sodium-based butyrate is usually more for the high-end athletes who really are, maybe getting a little bit of electrolytes back with their butyrate. But really, at the end of the day, I don't think it really matters which one you choose. Lots of makers of the prebiotic. At our office, we like the orthomolecular prebiotic, but there's a lot of good ones. You can find them endlessly on Amazon if you chose to. I would just recommend doing some research on reviews and seeing how people like them and looking at that with the prebiotics. But again, a prebiotic is basically specialized dietary fiber that fertilizes the obligate anaerobes.
And so there are supplements. Is there?
Yes.
The Body Bio, is that a good place to find it, or are there other places?
I think Body Bio does have a prebiotic. Again, in our office, we're orthomolecular, and so that's what we use. We like orthomolecular. They do not make butyrate, is why we go to Body Bio for butyrate. Butyrate's a specialized supplement. Body Bio has a lot of good products. They really kind of specialize in the brain and the gut. That's kind of where they have made their living. Anyway, that's where we get the butyrate from, although there's lots of other makers of butyrate, of course.
So these conversations always spin around to the peptide side of the world. If I was wanting a peptide, or if a physician was to go, all right, we're going to really get our act together here in your biome, what are some of the peptides that we would consider?
So you've already mentioned one, BPC 157. You probably already knew that was coming. BPC 157 is made in the stomach. It's made in the gastric juices of our stomach. And it is, again, something that I think that great news is it has gone over the counter now. If you by one manufacturer, so like patients of mine are I can actually just walk up, buy it on my shelf, and walk out the door. So it's good for the gut, it's good for the musculoskeletal system, and good for the brain. So we kind of hit three big functions there in addition to some other things. So BPC would be a great starting point. You can hit a lot of things with one oral peptide. And like I said, it's over the counter and, in my opinion, quite affordable these days. So I think that would be a great peptide to start with. And then the second one that, again, another workhorse peptide. It's actually a GHRP, a growth hormone releasing peptide. And that is actually ipamorelin, which is in the combination that we've discussed, CJC ipamorelin. But the GHRP, specifically the ipamorelin of the CJC ipamorelin, is the one that's really helping the gut through promotion of some specific enzymes in the colonic system. So with that growth hormone secretagogue, the CJC ipamorelin, not only are you increasing healing in the body, you're increasing brain function, you're decreasing body fat, you're increasing muscle mass, you're healing injuries faster. Like I said, you're also giving the gut a benefit there as well to have a healthy environment. So I would say the two major peptides that we would consider in dysbiosis is the BPC 157 and the CJC ipamorelin.
Wow. So the ketone esters, you had that on your notes today, and I take ketone esters myself. I feel it, I especially feel it when I don't take it, but I didn't know that there would be an expectation that'd be healing my intestines.
Yeah, so ketone esters, when you ingest them, they basically turn into what's called beta hydroxybutyrate, which is a ketone body, but it's not butyrate. So it's similar, but different. And it works very synergistically along with the supplement butyrate. But the big specific reason I put it on the notes is that one of the misconceptions about ketone esters or the ketone aid that we recommend is that it's actually causing fatty acid metabolism or the burning of fats. Well, it does, but only in the cells, not actually exogenously like our fat stores. And so, but when you combine it with butyrate, you actually can cause the fatty acid metabolism and actually get some fat burning from that combination of ketone esters along with butyrate. So it's that combination that's doing it, not the ketone esters per se. So I think that, so some people are like, well, should I take ketone esters or just a butyrate? The answer is you should do both, in our opinion. And there's also, Ketone Aid has a great new product out that I just wanted to give a plug for. I have no affiliation with Ketone Aid, but I just think that this is an amazing product. And they have a new product out called Snake Water. And Snake Water is really meant as a pre-workout, but it's basically electrolytes, natural caffeine instead of actual caffeine, and ketone esters. It tastes much better than the actual KE4, so that's one really cool part about it. But it's an amazing product for a pre-workout drink. And so we had the benefit of trying it because Frank from Ketone Aid was actually at our conference and brung us all samples, and we've already ordered a bunch of it and are using it regularly personally. So for any of those KE4 enthusiasts, you might want to just order a bottle next time of the ketone or the Snake Water and try it out as well.
I was listening to a conversation that Dr. Seeds had Frank on and was talking about one thing that was kind of interesting, and you may not know, but they were talking about they're noticing that taking micro doses of the ketone aid or the ketone ester there's a signaling component to it. And I was curious, where's it signaling?
They haven't quite figured that out yet. So that's what they're trying to work on right now. And so they're looking at that microdosing. And Frank himself says, people can take little tiny doses of ketone esters. I think Dr. Seeds kind of ranges more in a more is better type of thing, because I think he takes a lot of KE4 on a daily basis. At least I believe from our conversations, that's what I got out of it. So they're trying to figure that out. That's something that they're working on currently.
So does the VIP peptide, does that impact your gut area?
Yeah. So yeah, vasointestinal peptide would definitely be something that you could try as well. It has, VIP actually helps the brain and the gut. It's made in the gut. So I think that VIP would be a peptide that you could certainly try if you're kind of looking at going at brain and gut together. And that's where I think sometimes the rotation of the peptides comes back in. I still feel like most patients are only going to do so many peptides at a time.
Mm.
And that's why I know personally, like I rotate peptides in and out of my routine on about every 4 to 6 week basis. And I think VIP is one of those that would be, you can certainly use it long term, but when you're working on the dysbiosis, really there's no protocol for this. I think it's just kind of trial basis, hey, let's try this, see how it works. We know we're not going to harm you. That's the good news in all this, and just basically seeing how it goes. But sure, VIP could absolutely be tried, no doubt.
So if someone was to go, okay, I'm tired of this issue with my gut, they wanted to reach out to you, how is it that they would engage with you, and what would it look like in the beginning?
So, as COVID has come and is starting to slack off a little bit, how we see patients is a little different these days. We certainly would love to see patients face to face in the office. I still am a face to face kind of guy. I just feel like I can understand the patient more. I feel like they get a better feel for what I'm trying to do face to face. But telemedicine is here, and it's here to stay. And so patients who aren't in my area are welcome to call us. We can try to set up with them virtually if that's more convenient for them, and do our visits that route. So really and truly, it just starts with a phone call or an email to us, and seeing if we can help. Sometimes we just talk to the patients and maybe we're not the answer. Maybe though we have some ideas for them. If they're not, where we can actually take care of them with our licenses and whatnot, we try to hook them up with like-minded physicians across the country that are in our fellowship program. So that's the good news with our network, is we every week hook a few patients up with fellows around the country as well.
So one of the worst things to hear was like, hey, you're allergic to coffee. So
Yeah.
we got this comment here coming in from the research clinic. It says, I'm on day 2 and no coffee and have my alarm set to take ketone esters throughout the day. So there is hope.
You see a person texting in right now that's got to be the biggest fan of ketone esters maybe that I know, and so she loves her ketone esters, and I think you and I have talked about, of course that's my office manager / wife texting in or messaging in, and she has bad ADHD, and the ketone esters have not only helped with energy and the brain fog, but also helped with her attention deficit disorder. So and we've actually even there's some real thought that it helps autism, and we're just really starting to really understand ketone esters, and I think we're going to be amazed over the next few years with the good work that's being done and where we're going to go with it.
I was back to that conversation with Dr. Seeds and Frank, and he was talking about how people go, oh my gosh, I take this and with my coffee, and it's like it really increases the effects of the coffee.
Yeah.
And he's going, the esters are not all it's doing is making the pathway to your brain more better, I guess. I don't know what the term is, but the esters aren't giving you the spike in the caffeine. The caffeine is actually being more effective because of the esters.
Yeah, and you have to be careful. That's one thing that sometimes I forget, and I have to remind myself to tell patients who are caffeine users to go easy with it, because it intensifies your caffeine like 3 to 4 times, and so you just have to be careful. Some people can get too much caffeine rush from combining their normal coffee intake with ketone esters. And so ketone esters themselves do not have any caffeine in it unless you're using the snake water, which is a totally different product with ketone esters in it. But it does not have any caffeine in it. So it doesn't give you any jitters. It just is opening up those pathways and basically letting your body function better. It's increasing cellular communication, allowing yourself to function better.
So, and we got another comment that says she's going to commit to no coffee for 60 to 90 days. I hope that's going to be okay for you, Dr. Kris.
Yeah, we're going on vacation tomorrow too. I'm going to be curious to see how this works out for me. I'll have to make sure there's plenty of ketone esters packed in the bag.
So maybe the snake oil or the snake water with with
Yeah.
caffeine might be a nice little supplement.
Yeah, Frank does a hilarious marketing. He picked snake water, kind of going after the old, medicine man with the, like snake water. And his big marketing is no claims, just results. But on the snake water, it says will make you run 4 times faster, and then it puts in small print faster than walking, and things like that. So he has some really clever marketing, but it's a really good product, but, not necessary for the average patient. It's really meant as a pre-workout, but that KE4 is just amazing. And again, to the patients out there, we like the KE4, not the KE2. The KE2 is a watered down version of the KE4, just with a lot of ketone salts. Patients think they're getting it's cheaper, but it's really not, because you're having to take so much more of it that the cost is actually the same per dose. So I just think it's important that they realize that when they order.
So what are some specials going on at the Resurge clinic that our folks should know about?
I don't know. I wasn't given that today, Steve. So I'm not sure. I would just say look at our Facebook page and that sort of thing. I probably have spring break on my brain more than anything, because I'm 24 hours away, and it has been a long time since a vacation has been had. All of our traveling over the last year has simply been with trainings, and I know a lot of my friends say, "Oh, it's a training," but the training at SSRP is extremely intense, and it is definitely not a vacation. It's fun, but it's not a vacation. So we're looking forward to our vacation tomorrow.
Well, good. So this has been an excellent conversation. We learned a lot about the microbiome. There's so much more. If you want, there's a lot of great videos on YouTube that talk about the microbiome. You don't just have it in your gut. You've got it on your skin as well. There's a lot of fascinating things about the microbiome.
Yeah, I think if people just look into butyrate, and also maybe consider prebiotics, maybe just bring up the topic with their doctor, finding a doctor that is educated on the microbiome. I think patients can, but I would encourage most patients, after they talk with their physician, just maybe trying the butyrate. Anything that's inexpensive that can make big changes in our life, I think is worth giving a shot.
All right, excellent. Great show with Dr. Kris, age management and peptides. Appreciate your time, Dr. Kris. I'm Steve Brown, your co-host, and we're looking forward to next week's program. We're going to start getting these set up a lot sooner. So stay tuned, and more to come.
Thanks, Steve.
Thanks, Dr. Kris. And that's a wrap.